Okay, welcome everybody. Today we're going to talk about interviews specifically for residency in the US with the match. Medical physics students are going to have to interview to get into residency programs. And today we're going to talk about some strategies and techniques to improve your game when it comes to succeeding in those interviews. So I'm Dr. David Pearson. I'm the program director at the University of Toledo. And with me here today is Nate Haas. So welcome, Nate.
Thank you.
So Nate, tell me a little bit about the preliminary interviews that you've experienced.
Yeah. So preliminary interviews are typically, I think everywhere I interviewed had one of these, about 15 minutes. They're just going to ask you very basic questions. Tell me about yourself. You'll give your elevator pitch here. They might, probe a little bit deeper, like ask you what your short and long-term goals are, kind of what you want out of residency, and then why specifically you chose their residency. And then they might ask you a little bit about your resume, but these are typically just 15 minutes, just quick check to gauge your interest and check to make sure that, you know, you're you suit them well enough to have a follow-up interview.
So if you get a follow-up interview, do you think that's a good sign?
Yeah, I mean, I wouldn't say that it necessarily guarantees it that much. I think that it's pretty typical that if you get one of these preliminary interviews, then you're going to get a follow-up interview. So I wouldn't necessarily gauge, but I mean, it means you did something right, at least in the first interview.
Yeah, exactly. And I would just say that in my experience, when I've done preliminary interviews, it really is a very quick just gauge of their communication skills and their professionalism. So chances are they would have to do something like quite bad to not get the interview following that. But of course, there is always the chance that someone could like do a red flag. One example of a red flag I saw was we'd scheduled an interview for someone that we were considering for residency, and they weren't ready for the interview, so they were like not quite dressed yet.
Yeah.
So it was kind of they were clearly surprised when we did that call, even though we'd scheduled it. So that was a red flag, but generally, yeah, I agree that if you get an initial interview, there's a good chance you're going to get a follow-up interview. Tell me a little bit about technical questions. How often did you get technical questions when you were being interviewed for residency?
Yeah, they're definitely a lot less common, I would say, than just the regular, I would say like maybe more personality based is what I would call them interviews. Um, I think only two, I interviewed at six places. And I think only two of my interviews had technical questions, and then one of them only had one technical question. So they're definitely a little bit on the rarer side, but I would definitely be prepared because tip, it's not uncommon to be asked them.
Yeah. We'll talk a little bit more about technical questions later on, but just for now, I would say that yeah, I can kind of understand why programs may choose not to ask technical questions. They have access to your transcript showing all your physics grades, and ideally, they have access to information that shows that you've passed the ABR Part One. So in that situation, do they really need to ask you any technical questions if you've already got a good GPA in physics in a graduate medical physics program that's campus accredited and you've already passed the ABR Part 1, that may be enough to prove that you have enough what it takes to be trained the rest of the way for the clinical part of the job.
Yeah.
Um,
And sorry, I just wanted to go off that, especially, from what I've heard at the residency fairs, a lot of the programs just said they put more stock into seeing how well of a fit you are for the team and everything over how much you're going to come in with experience. Because a lot of residencies don't expect you to come in with much. They're expecting you to come in straight out of grad school, not necessarily have a clinical background. Um, and they prioritize a fit for the team more than they do someone who can rattle off a bunch of physics answers sometimes.
yeah. We'll talk a little bit more about the more common personality uh, questions in a minute, but you'd also I've heard that you often get invited to events, maybe social events, online social events like meet and greets with current residents. Can you tell me a little bit about that experience that you had?
Yeah, so they're definitely a lot more casual than the interview. A lot of them will tell you you don't really have to even show up, in a shirt and everything, a shirt, but not like a dress shirt or anything like that. Um, and it's a good, I think, way to kind of get a gauge of what the personalities are looking for there and kind of what, I mean, the co-residents are going to be the people you're going to be working with for 2 years. So it's a good gauge of what the coworkers are going to be like. And also, there are certain questions that are more typically asked in these resident only interviews than would be appropriate to ask the program director. So yeah, and a lot of times they're not mandatory, but I would say that if you have the chance to go to them because I think they're a useful resource on
Did,
deciding where you want to
did
go.
you ever miss any? Was there any that you decided not to go to?
No, I only had one or two interviews that had these, and every time I was able to make time to go. And they usually will make multiple of these sessions, because a lot of places will have multiple different interview dates. So they'll just let you come to either of the resident only sessions.
How did you act when you went to these supposedly resident only social events? Did you treat it like it was part of the interview process?
Yes and no. I mean, obviously I acted professional and put my best foot forward, but was not stressing like, I have to talk to the program director or anything like that. And like I kind of mentioned before, I think we'll kind of get into it more later when we're talking about what questions I ask, but there are certain questions that are better geared toward residents or maybe just are only really appropriate to ask the residents. And these are a great resource for that stuff. And so
Yeah,
it's
I think
definitely more casual.
it's a good thing to realize is that although this is an interview where they're the ones doing the interview, that's how we commonly think about it. But of course, you were also taking into account how comfortable you were with the program and with the current residents, how comfortable the current residents are, and so that's a big part of the whole how you rank the programs is based off to some degree how happy the residents are, right? So I think it is, yeah, I agree. It's very important to show up for these things. I would probably say if you're invited, don't skip it, just because it you have to take into account that it could be part of their interview process and that the residency program director is not maybe not there and listening to the meet and greet session, but is definitely going to ask the residents what they thought of you when you attend. So yeah, I think it's you have to take into account that they could it's all everything is part of the process, right? Everything is part of the interview process, and although you don't necessarily have to act like it's a formal interview and show up in a shirt and tie, you might be expected to be there. And if you're just super quiet, the current residents might say that they don't want to work with you and give you bad feedback, which may or may not be taken into account by the program director. You just don't know. So if you don't know, it's probably best to assume that there is a connection and that the program director is listening to what the current residents are saying. What can you tell me about how you prepared for the interviews?
So definitely have answers ready for the common interview questions, especially your elevator pitch, who you are, a little bit about your past experience. So just really quickly to run through mine, I introduced myself. I went through my education experience, so undergrad and grad school, and then talked about my clinical and relevant experiences in the past. If you're writing a thesis or have a thesis, great part to put that into. Talk about your thesis, and then a good way to wrap it up as well is to just say outside of work and school, just go through a few hobbies of yours, just to not come off as a robot and kind of show that you're a person as well. Um, I would say for the technical interviews, I think we'll get a little bit more into what kind of questions to expect, but definitely study any notes you have over physics. especially like if you've taken the ABR, that's a great resource. Any notes you've taken for the ABR. Um, Prepare questions to ask at the end as well. I had a list of 7, 8 questions that I had just ready to go and practice those as well. My first interview, I was not expecting to get asked, if I have any questions, and I didn't really feel ready for it. And after that, I drilled all of them every time and just had them to go on the back of my head, ready to go. And then as far as the actual interviews go, I would bring a calculator, I'd bring a whiteboard and marker just to show that you're prepared. Um, if you have to explain anything and you want to draw it, it's just a good resource to have. And then I would say dress nice as well. I think uh, I for guys, this is my experience, but shirt, tie, and then a suit jacket as well.
Yeah. Yeah, I agree. I think dressing appropriately is very important. It's going to definitely leave an impression if you dress appropriately, like professionally. But I think it's probably going to leave more of a negative impression if you're looking too casual for the interview. So it shouldn't be based on what you think physicists wear. It should be based on what you think physicists wear when they go to an interview. And those are not necessarily the same thing. You might see physicists that you've worked with who wear polo shirts or scrubs, and that might be appropriate for their day-to-day work, but that's not necessarily how you want to show up in an interview. So you do need to make an effort. The comment you made about the whiteboard and calculator, so hopefully the audience recognizes that that's the stuff that you would show up for the ABR with. You have to, especially the oral parts later on, you actually have to have a whiteboard, a small whiteboard that you can do your work on. I think you need it for the part one as well, right?
Yeah.
That's the one place you can do your calculations for the ABR part one. So yeah, basically turning up for an interview as if it's going, just in case it ends up turning into a mini ABR exam. What are some of the technical questions that you were asked, or what can you tell me about like the technical side of the technical questions?
Yeah, so I think that they tend to maybe fall in 2 lanes. The ones that I had kind of fell more into like problem solving aspect where there will be certain places that will ask you things that you should know off the top of your head. And these things are going to be, things you learned in class during grad school. So I just studied all my notes from grad school. And then I think that anything, if you've taken part one as well, anything that was on part one is probably fair game for you to be asked in an interview as well. Um, but like I said, there's also questions where they won't expect you to know the answer right off the bat, and they're trying to gauge more of your problem solving ability as a physicist over just your book knowledge. So I would say that when you get into a situation like that, it's really important to kind of just take a breath and take a step back. It's okay to take a second to think. You don't have to blurt out the first answer that comes to your head. And in my experience as well, the interviewers tend to be a little bit more helpful in working through it with you if it's one of those questions where they're expecting you not to know the answer.
Yeah. Yeah, I guess my one advice for this bit would be the same advice I would give people going into the ABR Part 3 exam, which is if you don't know um, the answer to the question that they're asking you, don't immediately say, I don't know. Just tell them what you do know. So start off talking about what you can recall about this topic. And that way, they're more likely going to help you if you're leading into it and you're providing some information. And if the information you provide up front isn't correct, they might lead you back onto track. But I would say just don't start off with what you don't know. Talk about what you do know. I'll give a couple of examples of questions that I've asked in the past. So I teach radiation detection and measurement class, and I have asked a few people like, how does a diode work? Or I've asked, how does an ion chamber work? And We do realize that people are not going to have all of the details of everything in medical physics memorized, but if they can come up with some of the information about the whatever is being asked, that's going to help. As you mentioned earlier, technical questions don't seem to be that common amongst all the programs, but you were obviously prepared for them, just in case they did happen. And I think that's a really good thing. You shouldn't just kind of go with the statistics and say, well, there's like maybe a 3 in 5 chance that I don't get asked a technical question, so I'm not going to prepare for it. You only have one shot at this interview, right? So the more you can prepare, the better. Now, it seems like the personality type of questions, maybe what we would consider to be traditional interview questions that honestly, you could probably Google some of this stuff. You could type into Google what is common interview questions, and there's a good chance that you'll get something like that in one of these interviews. So, what kind of personality type questions or traditional interview questions did you come across?
Yeah, so I think the biggest one, and you will hear this in every interview, most likely if it's one where you're in breakout rooms, which is a pretty common interview process where they'll have you on Zoom and 15 to 20-minute meetings with a bunch of people, you'll get asked over and over again, what are you looking for from a residency? And what do you like about our residency? And that's one that you need to have ready to go off the top of your head. Research the place before. I think that that's not something I mentioned in how I prepared, but you should go to their website, read through it, uh, and know about the program so that you can tell them what you like about their program, what you don't like, or you don't tell them what you don't like, but have the details of their program known. Strengths and weaknesses, that's one I've heard people get a lot. That's just one of the most common interview questions, I think,
What
on the
what did
planet.
what did you say your weakness was?
Uh,
Get judged on that one, I think, a lot.
yeah, probably not the best thing to say in a physics interview, but I said I wasn't very detail oriented. Um, but
All right, fair. Yeah, I would say that's not necessarily the best, but there's
yeah,
a whole bunch of answers for this question, and they're in a way they're trying to catch you out with giving something away about yourself. Um, but again, that's something you can prepare for, right? So this is a
yeah,
super common question. So just think about what you're going to want to say for that question, because the last thing you want to do is just come up with absolutely nothing and then have to rely on um, the last thing that you can think about yourself, which might be giving away too much information and might not be the best answer.
yeah. And I think that a couple of things about this question too. Don't try to make your weaknesses your strength. I think that that's off-putting to interviewers. They want someone who's being introspective and knows their weaknesses because that's an actual quality. Um, and then part when it comes to the strengths, I think that it's not only with this question, but in general, an interview is not a time to be humble. Obviously, don't go in being arrogant or anything like that, but don't downplay yourself. You're trying to actually sell yourself to these people. Um, so, you know, don't be arrogant or anything, but also don't try to be humble about it. If you do something well, come out and say it and, you know, be proud of yourself for having those accomplishments and everything. Um, but then some other things I heard, just asking questions about like leadership or times that you've had to use like creative solutions to problem solve. Um, and then if something's on your residency or your resume, if something's on your resume or CV, be ready to talk about it. I got questions asked about all my clinical experience, and I got questions asked going back to my research from undergrad that was on there. So yeah, if it's something that you even on your personal statement too, I have people talk to me about my personal statement. So yeah, if it's in your application, be ready to answer questions about it.
Yeah, that's probably yeah, good advice. Um, Now we talked earlier about that you should prepare some questions to ask them. What what questions did you use at the end of the like? And this usually happens at the end of the interview, right? Is where they say, "Okay, do you have any questions for us?" And the correct answer is, yeah, you should have
Yeah.
some questions because if you have no questions, you maybe haven't, prepared yourself thoroughly for this. But on the other side, it should also you should also avoid questions that are so obviously like don't ask how many residents do you accept or how many faculty do you have because this is stuff that should be clearly visible on their website and they will, as you said, prepare, read the website. They will expect you to know that. So you've got to think of some good questions. You can't think of just like off the cuff questions because chances are you'll trip up here. So what did you use?
Yeah, well, I think something that they don't necessarily, they'll talk about the rotations, but they don't really talk about necessarily the structure of the rotation in terms of how much hands-on experience you get. So that was something I always led with was, how much is it a didactic kind of rotation structure versus how much is it actually hands-on experience and learning. Um, Asking about things like physics relationship in the clinic, where what kind of work physics does, what kind of input they get to have in the clinic. I think that kind of shows that you kind of care and want to make a difference in the clinic. Um, Asking about the relationships between mentors and residents or the first and second year resident, how much are you going to be working with these people versus how much is kind of you're off on your own trying to learn on your own. And then one thing I kind of like too, especially like program directors who've been there for a long time, asking them how they've seen the program change over the years and where they see it going in the future as well. Um, and then as far as there are some questions that you should probably only be asking residents. Um, I always like to ask them what's one thing you really enjoy about your program and what's one thing that you would change if you could. Um, you can ask like how much of an impact you get to have on the clinic as a resident. You can ask about work-life balance. That's an okay thing to ask the residents. It's important to know as well, I think. Um, and then if you run out of questions, I think asking people about, the area they live in as well and what they enjoy about it. People are fine answering that question, and especially if they live in an area they like, they'll tell you all the cool things that's in that area. But that was kind of something I prioritized when I was applying, so that was an important question I thought to ask.
Did you ever run out? Because obviously, like you could have a day where you're interviewed by, well, I don't know. What was the largest number of people you were interviewed by in any day, in any one interview?
A lot. I'm trying to think. So,
So you probably felt obligated to ask a different question each time, just in case they were comparing, right?
yep,
So yeah, so it's a good idea to have plenty of these follow-up questions ready to go, and you just didn't keep them in your back pocket, just in the off chance you need them.
yeah. And I guess it's a good time to just talk quickly about the interview structure. There will be interviews that are like this, just me and you in a breakout room, 20 minutes at a time, and the interview will be, 4 or 5 hours long of just talking to people. So yeah, definitely bring water as well to interviews because when you're talking for 5 hours straight, you tend to get a sore throat a little bit.
Yeah, I did that. I did that today.
Yeah, I have my water jug next to me as well.
Yeah. Did you have any like very short interviews? Because at Toledo we do very short, structured interviews, so we can get through many, many interviews in a relatively short amount of time.
Yeah, so I think most of the longer interviews too were kind of like the Toledo interview, where it was a lot of interviews, but broken up into small segments. But yeah, I had a few that were 30, 45 minutes, not too long. And it was, I think, maybe smaller programs where they would just get everyone on the call together.
Oh, so they did some group interviews where like, everyone was there.
Oh, no, I was saying like their whole team was on the call.
Oh, okay, right.
But I
Yeah.
did have,
So it was just you, but they were in a group.
yeah, but I was in some experiences where they put all the residents or all the applicants in like a breakout room together. Or one place I interviewed was had us come down in person and they had us all like hang out while one person went up and interviewed at a time.
Yeah. That in-person interviews are not super common these days because it's so much easier to do an interview online. And if you're decent at doing interviews, you can pretty much pick up all the same like cues, good and bad, about the person you're interviewing without actually seeing them in person. What we do is if we were doing interviews, we would do completely online interviews, and then the people that we're trying to recruit to the program, we would bring them in, but we would tell them there's not an interview. Like we already made, we're already trying to recruit them at that point, and we would be come up clean and say that because obviously, as we talked about earlier, this is a two-way thing. Like when when you're interviewing for them, if you're a really good candidate and you might be getting lots of like offers or rankings, they're going to try and recruit you. So putting their best foot forward on an interview day is a good idea. Not everybody does that. There are some definitely you're going to come across some interviews where they're clearly not trying to impress you. But that may be a sign that that's not necessarily the best place to go. I've got some quick follow-up questions. I think we covered most of the stuff we wanted to talk about, but I got some follow-up questions for you. If the residents seemed overworked, did that put you off? And do you think you could tell, like if the residents were stressed and working too hard, were you able to pick up on that?
Um, the residents less so. I think sometimes you could kind of tell when you asked, just how many hours you work a week. Um, Even just the intonation about how many hours they work. If someone said, "Oh, 50 hours" or 50 hours, it's, it's a subtle thing to pick up on, but you can hear it sometimes. But I think the bigger thing you can kind of tell in the question sometimes. Like I think I had one interviewer more or less just ask me if I'm willing to put in a lot of hard work and late hours. And that was definitely kind of a red flag to just come out and ask that. Because I think it's kind of implied as a resident that they're going to be late nights. But
Yeah, they might be telling you that it's even more. Like,
yeah,
this is not going to, not even for an average, not even for an average resident. When you were ranking the programs that you interviewed at, what information were you using to determine what was a place that you wanted to go to?
yeah. So when I was picking out the places I was going to apply to, I went on all their websites, just went through all their information. I think the biggest thing for me was just variety of modalities. I wanted to see a lot of things while I was in residency, just a 2-year experience to kind of figure out what I wanted to work with in the future versus what I kind of wanted to avoid working with. Um, there are other things too. I mean, some places will show you where their residents placed in the future. Um, and that is a good way to figure out if a program's for you or not. I think that I did see on a website that they had a lot of people who were in like real estate and stuff. Um, that if they're not in physics anymore after the residency.
Oh, right, I get you. Right, so yeah.
Yeah. Um, and then like location for me was important too. I mean, I know it's only 2 years, and I was willing to wind up somewhere I wasn't super fond with, but I wanted to live somewhere that I was going to enjoy for 2 years.
And it could be more because, programs will sometimes have I mean, obviously it depends on the size of the residency program and the size of the organization that runs the residency program, but there might be jobs waiting at the end, right?
Mm.
And you might be the top person that they want to recruit. I mean, obviously they would rather hire internally with people they know than to do an external search, which is very costly and time consuming. It's much easier to just hire the people that you already know are trained for the job and are already currently located in the place. So you might be looking at a residency and saying, it's only 2 years, but at the end of the day, you've got to consider that there might be a job opening there, and they want to recruit you.
Yeah. And that
Um,
brings me back real quick. That's another good question to ask is if they have recurrent offers um, for their residents as well. That's something I asked at pretty much every interview just to see.
Right, right. Did you practice? You talked about how you prepared yourself for interviews. You had all these questions ready to go. You knew that there was going to be some questions you were going to get, or commonly you prepared for that. Did you by any chance practice? Like, did you meet with someone and do a backwards and forwards? With
Yeah. A couple of the residents at Toledo were super helpful for us, and they actually held mock interviews for us. So that was very nice. And so we went through that. But so if you can get a buddy to help you interview and come up with questions to kind of test your ability to work through, that's very helpful. But even if you don't, there are some things that you should be drilling out loud, just like in the mirror or something. Like your elevator speech is something I probably said that to myself 100 times before I had an interview.
right. Was there any external resources that you use to help you, whether it be helping you prepare for the interviews, or helping you rank the programs?
Yeah. So when I was applying, it was MP Wrap. I think it's all integrated in the National Mass Match Service now. But
Mhm.
the National Match Service should have a link to all their websites of all the different programs in there. So I went through all their websites just to check as far as ranking goes. Um, and as external resources to help with interviews, if you go on something like Reddit, you can find lists of interview questions. Obviously, they're not going to be specific from programs, but just common interview questions that you should be ready for a job interview. That's something I looked at and made a whole compiled list of questions I saw in there. Um, yeah, that's all I can think of right now.
Do you remember looking at or putting any comments into a spreadsheet that's floating around about the programs?
I did look at it, especially when it comes time where the offers are coming out. It's yeah, nice to see if you should wait around for
You actually, where is that these days? How do you get access to the like spreadsheet?
it's on Reddit somewhere. I'm not
Okay,
sure.
so you gotta just search for it.
Yeah, I think someone in my class found it and then sent it to me. So
All right, and then the last question I have for you is going to be challenging for you to answer, but do you have any idea on what a safe number of interviews is to know that you're going to rank and match in a place? And this is a bit of an open-ended question because there really probably isn't a fixed number, but do you have any idea, based on your experiences, what a good number would be?
yeah. So I had 6 interviews, and since Texas Oncology has the 4 different sites you get to rank, I ranked 9 different locations. Um, I've heard this before. I'm not 100% sure it's true, but I've heard that 8 interviews is gives you a pretty good shot at matching, and the interview rate is about 33%, so a third. So for reference, that was pretty spot on for me. I ranked 20 sites and got 6 interviews. And then I have the match statistics pulled up too. So in 2025, people who matched ranked 10 sites, whereas people who did not match ranked on average 7 sites. So,
So
um,
that might be a clue as to how many interviews they had, right?
right. Yeah.
Um, I guess one little piece of advice that I would give the audience is if you don't get that many interviews, maybe consider ranking places that didn't interview you, because there's always a possibility that they don't interview enough people and they have to kind of scramble to fill a position. And if you have ranked them, there's a small possibility that they just decide, well, I don't want to go through the whole process of interviewing again. We could just call this person that we already, you know, that already ranked us, and maybe they'd get it. But yeah, it's a bit of an off chance, but it might be a good idea. Well, thanks, Nate. I think, well, I hope that's helpful to the audience, and we'll see if this gets out there, and it helps the people in our community, the medical physics graduate students who are stressing out about, especially this time of year, going into the match and looking to interview as well as they can to get their best chances of matching a really good program. So thanks for joining you. Thanks for bringing your expertise to the table, and we'll leave it at that. Thanks a lot.
Yeah, thanks for having me. It's good to talk.
Thanks.